Okay. Hi, everybody. Welcome to Integrated Parasite Management for Small Ruminants. I'm Betsy Hodge. I work at Cornell Cooperative Extension in St. Lawrence County. And I'm going to start with a little bit of Zoom etiquette and then go to the Parasite PowerPoint. So it's being recorded tonight. And it's ideal for us if you keep yourself muted during the talks. Put your questions in chat or raise your hand and somebody will get to you. If you put them in chat, it helps because we've got a couple people like Tatiana and Kelsey that can monitor the chat and answer the questions or stop the speaker. And it'd probably work best if you use speaker view, which if you go, I think I can have a little picture here. Yeah, if you go up in your upper right-hand corner under view, click on what this says speaker view. That means that you'll have the big picture most of the time, and the rest of the people will be little on the side. And ideally, keep yourself muted. The little mute looks like a microphone, and it's normally down in the lower left-hand corner. And also your video is there. And I don't know if your internet's good enough, you can keep your video on. If not, probably not. Questions ideally would go in the chat. If you click on chat, it opens up. You can type in your questions and we can all see them. You can also try raising your hand under reactions. Okay, let me stop sharing that. Excuse me, I gotta find my PowerPoint. Then we'll get in slideshow here. There we go. So we'll begin with parasite management for small ruminants. And I'm gonna do part, and Tatiana Stanton, also from Cornell University, is going to join in, and you can give yourself a little introduction then to Tat. So a lot of these, there's a lot of great pictures in here, and there's slides from a whole lot of different people that have done parasite talks, and we just want to recognize them here. So we're going to talk tonight about parasites in sheep and goats, and we have a great area for raising sheep and goats. We have a lot of grass and forages, but we also have a lot of parasites because we have moisture and we have warm summers, and it becomes a major challenge if you're a pasture-based operation. And most of us really like to use pasture if we can. And so we need to learn to control and manage these parasites. So we're going to talk about what is the problem. And this is actually a video. I'm going to click here so you can see it. Hopefully you didn't just eat dinner. There's actually little worms on here. They go by a little. Let's see if we can get one. There's one right there. Yep. Those are Homuncus Contortis. We're going to talk about those in a minute. It's a great video. There's another one. So we're going to talk about stomach worms, and this is what we're looking for when we do a fecal egg count. And those ones that are circled are all very similar. You really can't tell them apart under the microscope. So chances are you have more than one kind anyways. But this one over here, let me get my pointer back. This one is the Homuncus Contortis, or the barber pole worm. And as you can see, it looks very similar to the others. This one's a little bit bigger, but otherwise they look pretty much the same. So gastrointestinal worms, most of them have a direct life cycle. The eggs hatch in the manure of an infected sheep or goat. The larva goes through a few molts right on your pasture, and then becomes infective larva, which is in turn eaten by a goat or sheep. And then that is inside them, and when that matures, it breeds and produces eggs, which are then shed out onto the pasture again. So it's a direct life cycle. There's no snails or insects or dogs or cats or anything in the middle, just directly from the pasture to the animal. And they can tolerate cold temperatures, and some of them even overwinter on pasture in some places. And it tends to be a pasture or barnyard problem, especially if your pasture is small and they're re-grazing over areas they've been. And if there's moisture there, that seems to really keep it going. There's not too many picked up in the barn. You know, your animals aren't necessarily eating off the ground there. Hopefully they're eating out of a feeder. And the ammonia gas from the bedded pack helps discourage their survival. Sorry, it's a little tricky to find the little arrow there. So Homuncus contortis, or the barber pole worm, it's a blood-sucking parasite that pierces the mucosa of the abomasum. That's that true stomach that's part of the ruminant system. And it causes blood plasma and protein loss in the sheep or goat. And this is a barber pole for those of you that are too young to remember what a barber pole looks like. And this is a barber pole worm. I think this is the female that you can see the red and white colors on. Pretty fancy looking. This is the mouth parts that pierce the lining of the abomasum. And I'm going to, just give me a minute, I got to minimize my thumbnails here. It's originally a parasite of warmer climates, but it spread to the northeast. I don't know if that's through climate change or because we moved animals around too much and brought it along with them. It has a short generation time, can be less than 3 weeks. And it's a heavy egg producer, so it reproduces very quickly, especially in the warm, damp months of the year. 5,000 to 10,000 eggs each, and multiply that by all those having babies. So each worm can consume 0.05 mLs of blood, which doesn't sound like very much blood until you multiply it times all those worms. And a lamb can lose as much as 1/5 of its blood volume in a day. You can imagine that makes them not feel very well. And it can infest and kill a host in 4 weeks. So the weird thing is you don't see a lot of signs of this, like you're looking at the sheep or goat and they don't have diarrhea, they don't look sick, they aren't necessarily looking unthrifty. So how do we know, what do we do about that? Okay, so the clinical signs of the barber pole worm infection are a little different than you might expect. They're pretty subtle. An animal can look terrific and be dying of the barber pole worm. And I sometimes have people call my office and say they found an animal dead and they were shocked. And if it's at the right time of year, it's a good chance it was a barber pole worm. The primary symptom is anemia. And if you look at this, this is the eye of a sheep or goat, and they're pulling down the lower eyelid and looking at the mucosa right here. And that's white like a piece of paper, and it should be nice and pink, much like the inside of your own eye if you look at it in the mirror. And so this is a very anemic animal, very anemic. And they may also develop bottle jaw, which is this loose flap of skin with very liquidy. It's sort of a floppy thing. It's not a firm thing. It's like a floppy sack of fluid under their chin. And that's a result of the fluid leaking from the blood and collecting between the mandibles. There are other things that cause bottle jaw, but this is pretty classic. Let me just go back there. Just the other sign you sometimes see is, I can get back. Anyways, the other sign you sometimes see is an animal that's sort of lagging behind the others, acting kind of sign that they are very anemic. So let's talk about the brown stomach worm. This used to be considered the most serious parasite of sheep and goats in cool climates. The worm develops in the gastric glands of the stomach, the abomasum again, and destroys the glands as they grow. And so that means they're not going to be able to utilize all their nutrients. Their digestion is going to be messed up. It affects their appetite, and they do have diarrhea. And they say they don't eat as well. They may have weight loss. Basically, they look pretty unthrifty. And it's a little easier to see that this is happening and know when to treat them. Sorry, I'm just having trouble with the little clicker here. Doesn't want to go to the little arrow. There we go. And there are other strongyles or stomach worms. And these worms all disrupt the digestion and absorption of nutrients by damaging the gastric glands and the abomasum, and damaging the lining of the abomasum or the small intestines. And the clinical signs are fairly obvious. What we were just talking about, diarrhea, scours, weight loss, rough hair coat, unthriftiness, And you can see down in the corner here, you can see what some of those eggs look like. They all look basically the same. Only way you can tell is through special dyes or assays that most of us do not have the facilities to do. And here are their names. I'm not going to even try to do them, but they're all out there. And it's hard to know which one you have. Fortunately, most of the dewormers, they get most of the other ones of this type of worm. And then there's Strongyloides. So Strongyloides is similar, and we had sort of an outbreak of this end of last summer, fall. And it's an intestinal threadworm or pinworm. It's not like the dog and cat species. It does not infect people, which is nice. Better. Complicated, it does have a complicated life cycle because it can reproduce sexually or asexually. And it can infect animals in several different ways. It can infect them by ingestion from the manure in the pasture, from the dam's milk if the larvae migrate to her udder. So the babies can be getting it there, through the skin besides, and the hairline just above the hoof. So if it's muddy, which most of us have had a lot of mud here recently, until the last few days when it's been really nice. And if the pasture's infected or it's in the manure and it can get along the edges of their hooves, it can actually get in through the skin. And it can get in prenatally if the larvae have migrated to the placenta. So they're pretty crafty little buggers. And the larvae are sensitive to cold and dryness. But of course, all summer we have mostly heat and wetness. And the symptoms are diarrhea, a good chance that it'll be diarrhea. They could die from it, although most people would, I think, pick up on the signs before that. If the lungs are infected by the migrating larvae, they may be some coughing or pneumonia. So it's a pretty nasty thing. We didn't have a lot up in our particular flock last summer, but I know Tatiana saw some with flocks she was working with.
Yeah, we saw a lot in flocks, and the egg is very easy to tell apart from those strongyle eggs. It's a smaller egg, and it usually has formed larvae in it instead of just a nucleus.
Right. So this is a totally different family of worms, the tapeworms. Looks a lot like linguine or fettuccine. And it's one of the few worms you can see in the manure. So it doesn't necessarily look like this in the manure. And a lot of times in the manure, it looks a lot like pieces of rice. So these come apart in little segments. It looks like white rice mixed with the manure. Once in a while, you have a lamb with a big long one hanging out, which is really great when you're giving tours. We give tours at the extension farm, and those are the sort of things you dread while you're giving tours. The life cycle, the worms live in the small intestines, and they pass out with the feces. And the egg is eaten by a pasture mite. So the egg hatches in the mite, and the mite is eaten by the sheep or goat. You probably didn't even know there were mites on your pasture. I know I didn't. And you can't really see them out there, but they're out there and they're an important part of this life cycle. Light lobes of tapeworms tend not to be a problem. They sort of build up a resistance to them, so you almost never see them in the adults. Tend to see them only in the lambs. And at least where I live, you tend to see them sort of the end of June into July, showing up in the lamb manure. But you can have stations, and that can cause problems. And it's a good reason to vaccinate your lambs and young goat kids with CDT, because sometimes they build up an infection in the small intestine from all the worms in there. I don't know if it's the worms dissolving or what it is, but I have opened up a lamb and pulled out piles and piles of worms.
So Betsy, what it is this tapeworm is actually fairly starchy. So it's just like the animal eating a bunch of corn or something. The bacteria in the small intestines that work on starch multiply and put out a toxin, put out that Clostridium.
Yes, so it is like overeating disease.
Yeah, so it's very simple. So basically they get overeating disease.
Right, which CDT is a vaccination for. So I sometimes do treat my lambs if it looks like a very big infestation, but I also have left them and it looks pretty bad, but they did okay. And they do, it's a different class of wormers. Not all dewormers get tapeworm. So if you're trying to treat for tapeworm, make sure you have a dewormer that works for that. And we'll talk about that in a little while. So here's our picture again of the different eggs and larvae. And we're going to talk about lungworm, which you don't see the eggs of, but you see the larvae. So lungworms have an indirect cycle through a snail. We're going to find out that snails are a big problem for sheep and goats. And so they have indirect life cycle through a snail or a direct life cycle, certain ones. And I was up late lambing last night. Severe infestation caused coughing, fluid in the lungs, and pneumonia. So the cases I've had, the animals cough a lot but don't act sick, at least not at first. And it's excreted as a larva, not an egg, in the feces. So if you take a fecal sample, ideally you'd take it direct from the animal so you don't pick up something from the ground that looks similar. And the ones I've seen, they have this typical curly hue. I may have been seeing others too, but these I could recognize. And fortunately, the same medicines that get the stomach worms and intestinal worms will get the lung worms. I did actually have a llama and a ewe go down on Christmas Eve. Of course, vets love it when you call them on Christmas Eve, and I don't blame them. And fortunately, they were able to advise me over the phone, and I treated with a dewormer, and everybody survived fine. But the ewe never really got over the coughing, and I ended up culling her in the long run. So it's out there, and for a while we treated every fall, but we don't like to treat all the animals in the flock at once, which we'll talk about again later. And so I don't do that anymore, but I keep an eye out for it. It tends to hit later in the fall or show up the actual symptoms tend to show up later in the fall, at least in my area. So let's talk about liver flukes. There's 3 kinds of liver flukes, and they're in the liver. And some farms in the Northeast have acute or chronic liver fluke populations. And if they're in your area, that's not good. You'll need to watch for them and treat for them. It does require water, or at least very damp conditions, and snails. They can kill, you can kill adult liver flukes with albendazole, which is known as, you might know that as valbazin, or Ivermectin Plus, which has chlorcelon. But you can't kill the immature flukes. So meanwhile, these immature flukes are traveling around in the livers, making them feel terrible. So let's talk about a little more in detail. So the indirect life cycle has a snail or a snail ant intermediate host. So Fasciola hepatica, this is the sheep liver fluke. And I don't know, do these affect goats the same? Or is that just a sheep thing?
Betsy, Fasciola hepatica isn't supposed to be west or east of the Mississippi River.
I know that, but I know that the vet in Brazier Falls has found them in somebody's sheep here, so.
Right, but they never know if it's sheep that actually were shipped here and had it when they were shipped here. They're still
But they don't live in the wild, you're saying.
On that. But yeah, it affects goats the same way it affects sheep.
Okay.
You get chronic infection.
So hopefully you're not getting this and not bringing it into your flock either. Fascioloides magna, or the deer fluke. I bet everybody here has deer on their farm, unfortunately, for the sheep and goats, because they carry the deer liver fluke. It does not bother the deer or the elk. However, one fluke can kill a goat or sheep due to its extensive migration around in the liver, and it travels all around, and I'll show you some pictures of some livers in a moment, and you can see the damage that gets done. And then there's the...
And Betsy, it's primarily in deer populations in the Catskills and the Adirondacks. And I don't know if that just means that they shed so few that unless you're in a super heavy deer population, it's not much of a problem. But I know, like in my area where we do have a lot of white-tailed deer, it isn't thought to be much of a problem. So I think it's just more for some reason, maybe the conditions in the, you need more of those mountainous moist conditions for it to really thrive. So, but Catskills and Adirondacks are really bad, and your local veterinarian will almost always know if you're in a bad liver fluke area.
I know they had them in the cows as well.
Yeah.
The Lancet fluke is not a health problem very often, but it does cause the livers to be condemned at the slaughterhouse sometimes.
And that one is throughout New York, the Lancet.
So here's a little more details. The Hepatica is the common liver fluke. We were just saying used to assume it was not east of the Mississippi, but some veterinarians have observed some affected animals in New York. The life cycle includes freshwater snails, causes acute peritonitis to the liver. It migrates around in there. I don't know how they know where they're going, but they go all around in the liver. Often causes chronic wasting problems afterwards. And you can see bottle jaw from that. That's the hypoproteinemia and then anemia. And the Fascioloides magna, this is the deer fluke. Here we go, found in the Adirondacks and Catskills. Got a little ahead of ourselves there. It is a natural parasite of the deer and elk. And in the sheep and goats, it's an abnormal host, and it never matures. It just stays in the tiny larval stage, but it continues to migrate around through the liver and into the abdominal cavity. And the good news is they don't spread it to each other at that point. It is acute and it can kill them. And you'll see why in a minute. Here's the liver of a goat killed by deer fluke. Now, when you think of what liver ought to look like, it should be smooth and sort of reddish brown, and it shouldn't be all full of all this scar tissue and sort of hamburgery looking stuff. And interestingly, if you can save these animals, their liver will actually improve. So treatment for liver flukes, I'm going to actually go to the next slide and come back to this one, because I want to show you this liver. Unfortunately, this is my kitchen sink and liver from some of my sheep. And we had lost a bunch of sheep, 15 ewes out of about 105 or 110 sheep between October and Christmas. But while we were trying to figure out what was going on, did a whole lot of necropsies on top of the manure pile when it was about 5 degrees out. And they were actually, the ones that were dying, I was mostly finding dead, like in the morning, the sheep would all get up to eat and there would be one dead on the floor, and they were dying from this Black's disease or Clostridium novii that the liver flukes were dragging around through the liver. And you can see other organs like stuck to the liver with fibrinogen. So the whole insides were irritated and stuck together. So we ended up administering, we actually used Vision 7, but you can use Covexin 8, something that's got Clostridium novii protection. And we treated them also with the Valbazin and with Chlorcelon, as per Dr. Mary Smith from Cornell's instructions. And we stopped it, but it was pretty scary when it was happening because it took a little while to figure out. And we did save some that had it, but didn't get the Clostridium. And they were like standing with their head in the feeder, but not eating. So they had no appetite and they felt terrible. And we were able to recover those with a lot of TLC and nursing. And they did actually recover and become productive again. But it was. So what do you do about liver flukes? So you can try to fence off wet areas and stay out of the swamps. So I think the way we got them is I was trying to be nice and I fenced in the corner of the woods so that the sheep would have shade. They were in a pasture quite a ways from the barn, long ways from the barn actually. And I think in the process, the trees sort of kept it damp and there were a lot of snails under there. So try to avoid those areas. You're not really doing the sheep a favor or goats by getting them into those places. Along hedgerows is the same way. Those places where you have that real tall sort of reed canary grass that can sometimes have a lot of snails also. Places where the sun doesn't hit. It is harder to kill the larva than the adult flukes, and the deer worm does not become an adult fluke, so that's a problem. We use albendazole, which you may know as valbazen. And you'll have this handout, so you'll have the actual dosages.
And Betsy, one thing to point out that, I remember when you had it, initially you couldn't use the valbazen because you had pregnant ewes in early gestation that you didn't want to accidentally abort. And so you were searching for the Ivermectin Plus at that point.
Right.
Actually.
And especially we were giving the valbazen at like 5 times the normal dose. And the course we did find Ivermectin Plus, which we gave them along with the big thing was the vaccine. I think really is what saved most of them. And here it is this is the Fascioloides, is the deer fluke here. I think I had one this fall with it also. She was really sick for a long time and I nursed her through it. Oh, coccidiosis. Coccidiosis is a little different, tends to be in sort of an inside parasite, as less than a pasture parasite. It's a single-celled protozoa and it damages the lining of the small intestines, which means they are not going to absorb nutrients as well. And tends to happen around 3 weeks old or 3 weeks or a little older. And you might have heard it called mucky butt in lambs, makes this sort of really dark colored, icky diarrhea. And it spreads so easily in the infected feces and in the bedding and around the barn. So you know how baby animals have got to put their mouth on everything, on every feeder, and they're always putting their mouth on stuff on the ground and like tasting it. And that's so easy to pick up the coccidia. And it is real typical in young animals. So this is an intestine, and this is these little white spots or white foci in the intestinal wall. That's where the absorption is impaired, and it can damage both the small and the large intestine, which means they aren't going to be able to absorb nutrients very well. And I don't know, it seems like that lasts a long time, even if you treat them, that they often don't thrive as well as they should. So it's species specific. So many of the Emiria species are host specific. And there is immunity to the species of Coccidia as they get older and have exposure. So it's best if they have mild exposure at first so they don't get an acute case. And you want to avoid sudden exposure to large amounts of infected feces, like taking small animals into a spot that's had a lot of adults, for example. They're more vulnerable when they're stressed, when they're young, when they're really old, when they're weaned. Anything that's in a stressful situation is more vulnerable to coccidia and really to most of the parasites as well. So it tends to be when they're housed together in a smaller space. So if you can lower the density of your animals, that helps. It also helps things stay drier, and that helps keep the coccidia down. There's some other tricks too, I think we have here. Right, like warmth and moisture, and it can go from egg to infectious in just 1 or 2 days. It's also oval looking when you look on a slide, but it's quite a bit smaller than the stomachworms. And it's killed by the sunlight and low humidity. So if you can have a sunny area in your barn, I have a greenhouse barn, so it tends to be very bright and the bedding tends to be dry, which is a big plus. Might be the only plus of the greenhouse barn, but it is definitely a plus. But none of us have animals that go in the feeder, right? I know they love to get in the feeder, stand in there, poop in there, and that's how it spreads. I think, yeah, here we go. Keep the, actually can't read the top of the slide, but we want to keep the young animals away from the adults where we can. If possible, separate them by age. So only have a 2-week spread in age in the group. So if you have your lambing or kidding is spread out over a long time, you're going to have newborns being born when you have 3 or 4-week-old animals that might have coccidia infecting each other. So to keep that in mind if you can. Milk is protective. So weaning is a very high risk time for coccidia. It's stressful, and then they don't have the milk as well. And again, clean, dry, if you can get sunlight, and be especially careful at weaning. I think, do we have something in here about the, yeah, the additives, here we go.
Or Betsy, if I can just tell a little case study.
Sure.
Okay, so if you go back to the previous slide. So with these dairy goat kids up here, this was in California where it's fairly dry, but we were having trouble, in part, a big problem you can have with dairy kids if you're raising them on raised flooring, which initially we were, and then you put them down on the ground, and you're putting them down on ground where you've had adult animals, or have had, in our case, we had kids that were more like, 3 or 4 months old on that ground. And we did that right at weaning. And so right at weaning, the kids got exposed to feces for the first time, because since they'd been on raised flooring, they hadn't been, exposed to feces. And so right then, when they were losing the protection from milk, they got exposed. So we'll often say that since weaning is such a high time, to talk to your veterinarian about whether there's something you can maybe do a week before you start weaning for these animals. And then also keep in mind that if you're selling bottle kids to people, those bottle kids, while they're at your farm, can be doing fine, but they can have been infected with coccidia, and the stress of moving to a new farm can have them suddenly have coccidia population multiplying. And so when you talk on the next slide, when you talk about, some of the chemicals we can use, you can talk to your veterinarian about whether you can use some of those. And otherwise, if, just let people know what the symptoms are when they're buying bottle kids and lambs from you, so that they'll be prepared to identify that diarrhea, that kind of diarrhea is not going to be normal. Okay, and I'll shut up.
Okay, that's a good point. If I can get the clicker to work, there we go. So there are different coccidiostats out there that can be added to the feed, or the mineral, or potentially the water. And so there's a trick of putting it in the minerals for the pregnant females about a month before they start to lamb and kid. And you can keep it in there until they're weaning their young, and that just gets the whole level of coccidia down in the barn and in the feces. And there's a couple different things you can use. There's Ovatec, but not in dairy animals. Rumensin. I find most of the feeds now that have a coccidiostatin have decox. And then the feed companies like decox because it's less toxic to horses, I think. And there's amprolium or corid, which is more of a treatment that you put in the water or in the milk. So let's see what this one is approved for sheep, but toxic to equine. This one is approved for goats, also toxic to equine. This one is approved for sheep and goats. That's probably why I see decox in most of the feed. And corid, again, is a treatment you can use to put in the water. I prefer to use it as a drench and apply it directly. So if you want to treat it, there is chemical treatment for coccidiosis. There's the oral sulfonamides like Sulmet or Albon. Because of the veterinary feed directive, they need to use a vet prescription to use some of these things in the feed, or you may not be able to be prescribed, or may not be able to be prescribed to use in milk. I assume this is the milk you're feeding to the babies.
Right. What it is with the veterinary feed directive, you're supposed to go with, you're not supposed to use it off label. And so because the labels on these don't mention mixing it into the milk, some veterinarians will say that you're not to be mixing it into the milk. You can mix it into a milk replacer if you're mixing it into the water first and then into the milk replacer. That comes into being, particularly there. Some people used to be in the habit of using Sulmet or Albon for the last 5 days before weaning. They would put it in the lamb bar for the lambs, or for the goat kids to just have them have that coccidia population that they might have been developed sort of knocked down right before weaning occurred. But technically, some veterinarians may say, you better not use it that way anymore. The chorid doesn't fall under the veterinary feed directive, so there's more flexibility on how you can use.
So there are directions on the chorid on how to mix it, or the concentration, and I find it works better if you haven't got 300 lambs to do or something, if you can dose them for 5 days and be sure they all get what they're supposed to get. I find it works better that way. Again, none of these really like kill off all the coccidiosis. They kind of tamp it down. So you need to make sure all the other things are happening too, like maybe the pen is getting cleaned out and clean bedding put in and it's dry and all the other things that need to happen to make coccidia go away. I also like to make sure they have the right minerals like selenium to help their immunity, because they're going to try to build up an immunity against this. And you may need to give them a little supplemental nutrition or electrolytes if they're having a hard time with the coccidio, and try to relieve the stress like at weaning as much as you can. And we're up to the meningeal worm. And I think you're going to talk about this, Tatiana. Do you want me to stop sharing so you can share? I can start if she's not there at the moment.
Or Betsy,
Yes.
If you want, I can just continue using your slides.
Okay.
That works for you. But I think somewhere in here I may stop sharing just to show some resources. Okay.
Okay. Yep.
But why don't I, for right now, just continue on with your slides?
That would be fine.
So we're going to talk about the deerworm now. And it's a parasite of white-tailed deer. In white-tailed deer, it's generally non-pathogenic. It very occasionally will cause problems in them, but for the most part, it doesn't cause much at all in the way of problems. And it's sort of the opposite of your barber pole worm, in that this is a worm that your animal only gets a couple of, just one worm. One deer worm can cause a lot of damage. And this worm is extremely long-lived in your animal. It's not thought to reproduce successfully in sheep and goats, but one worm can live for 6 or 7 years in an animal, in a deer, in some of the work they've shown. And unfortunately, small ruminants are abnormal hosts. And this includes fallow deer. If you have a fallow deer farm, it includes elk and moose, and then your llamas, alpacas. And we have seen cases of very young calves being infected. If it infects horses, it shows a whole different symptom in horses. So generally the animals we're concerned about are small ruminants and our camelids, like our llamas and alpacas. Okay. It has an indirect life cycle. It needs a snail and slug in order to go through its full life cycle. Okay. The deer eats forage so I'm going to go through what the life cycle is in a deer. And the deer eats forage that contains a slime trail from a slug or a snail that has been infected with the and is excreting the third stage larva. It's that third stage larva that's infectious. Okay. And then that larva, after the deer has eaten that forage, the larva migrates through the stomach wall into the peritoneal cavity. And from there, it can get into the lumbar spinal nerve. So along the short ribs there, it can get in there. And then it reaches the spinal cord in about 10 days after first infecting the animal. And once it gets to the spinal cord, it's going to become a lot harder to kill, because the dewormers going to have to get through the blood-brain membrane. And in a deer, it develops in a totally orderly manner in the gray matter of the spinal cord. Okay, and then at the end of about 40 days, it comes back to the surface of the spinal cord, and it matures and it migrates into the brain, into the crania, and lives and reproduces there. and then the eggs are laid into the blood vessels. And it really, even though this seems really invasive in the white-tailed deer, that, you know, it's essentially cohabitation. They get along just great. And then the egg hatches in the blood vessels into in the lungs as it travels there through the blood into first stage larva, and there it goes into the bronchial tree, gets coughed up, and the animal re-swallows it when it coughs it up, and it passes into the feces, and these first stage larvae are excreted in the feces. And so that's what it does in the deer, basically. And like you, I'm having trouble moving. Okay.
I have to move them for you.
It's in the mucus coat there of the fecal pellets. And it's usually excreted about 90 days after the deer has been infected. And these first stage larvae can be killed by drying or by direct sunlight, but they resist freezing, unfortunately. And land snails and slugs then crawl over that deer feces during the fall or summer. They crawl over it or in the spring, and the larva gets into the snail or slug through its foot, and then it develops in that snail or slug into the third stage larva. And this actually takes a pretty long time. At Cornell, with the snails we raise in the colony at Cornell, it usually takes about 2 to 3 months, and we have them at 70 degrees Fahrenheit. We have them at room temperature. So in warmer temperature, it'd probably happen a little faster. And then it can stay inside the snail or the slug, or it can be excreted in the slime trail. And there are not a lot of these larvae in any individual snail. There's only, on the studies they've done, there's usually an average of about 3 larvae there. And we actually, with the colony at Cornell, we have trouble getting them to produce enough of the larvae. You know, even though we infect them pretty heavily, they actually, each snail only really grows out, you know, to third stage larva, a fairly limited number of larvae. But unfortunately, as we said, it doesn't take many of these to really damage your animal.
I don't think I'll never look at deer and snails the same way again.
Okay, so unfortunately, as we said, small ruminants and camelids are an abnormal host. So in a snail, in a sheep or a goat, the larvae travel from that intestinal tract to the gray matter of the spinal cord, just the way they did with the deer. But at this point, they become disoriented. It's a different spinal cord than what they evolved to travel through. And they become disoriented, and therefore they become way more active in there, trying to figure out just where the hell they are. And they can cause nerve damage because of this. And the nerve damage we generally see will be some sort of lameness or weakness in the hind end, but it's not always limited to that lumbar region. You can get it anywhere along the vertebrae. So the damage can be up at the neck, all the way back. And so we can have front legs, even though typically we see it in the hind legs and in the back, we can see the damage in the front legs occasionally. And the animal will often slightly drag a hind leg, or as they're turning, they'll stumble. Those will be sort of the first signs you see, and then it can get worse and worse. The other sign you sometimes see, and it's not necessarily in the same animals that show these problems with the way they're moving, is you can get damage to the nerve cells in the skin layer. And then what happens is, and it'll be under a vertebrae, but again, it can be under a vertebrae anywhere from the neck to the tail, you know. And so the animal, wherever that nerve damage has been in the skin layer, the animal feels a constant itch, and the animal will scratch, scratch, scratch at the same location, thinking that, and they can rub themselves raw there. And it can be a little tricky in that we usually get that right about the same start of black fly season. And so you're going, okay, is this sore because of deerworm telling me that, ooh, I've got a deerworm issue going on in my herd right now, or in my flock right now? Or is this just black flies or noceums. Unfortunately, with the lameness one can progress to the point where the animal's hind legs become completely paralyzed. And at that point, and occasionally we will see death if the nerves that are affected are affecting the animal's ability to breathe, or if the animal starts laying on one side and fluid builds up in the lungs on that side and the animal gets pneumonia. Very typical for deerworm damage, unlike a lot of other neurological diseases like polio and encephalomalacia, or goat polio or sheep polio, or listeria, the animal will typically maintain a really good appetite. So it'll be really frustrating. You'll have this animal down that's really eager to eat, but it can't get up. Okay.
And what about blindness? Isn't that potentially a symptom also?
It can affect the brain, and in that case, you'll get twirly eyes.
Yep.
I haven't heard of anyone getting true moon blindness, but that doesn't mean you couldn't. But what we have seen is twirly eyes with it. But then we usually recommend that people treat with thiamine as well, just in case it's polio, goat polio, or polio and encephalomalacia instead. We usually can't rule those out. But yes, it can affect the brain. And so because of that, I could see the possibility of you seeing moon blindness, an actual blindness going on as well, but generally not. And in horses, I believe that is more one of the symptoms you'll sometimes see. Okay.
I know what happens to me is I have it so rarely that I don't recognize it. And I think, well, this sheep must have got, smushed at the feeder by the other sheep, or they sort of look like they're a little drunk or something, and they're wobbly in the back end, and then I realize, it takes me a little bit to realize that it's probably the deerworm.
And Betsy, okay, great. It moved. Okay.
You have to let me know. I'm moving it for you.
Okay. Oh, that's right. Oh yeah, you have control. I'm sorry. Okay. And so up to a few years ago, there'd been no real controlled studies in sheep or goats. We did, at Cornell, we did do a 3-year study. It was an informal study, but it did involve a lot of farms. We actually worked with 16 farms, maybe as many as 16, but some of the farms said that as soon as they enrolled in the study, it was great. They stopped having issues with deerworm. So not all the farms had animals with deerworm during the study. We chose farms that were within a 30-mile radius, I think, of Ithaca. And we chose farms that had all had experience with deerworm before, because the farmers were going to have to identify that they thought the animals had deerworm. And we looked at 2 different treatment protocols for it. And then what we would do is the farmer would call us and say, hey, I've got an animal that I think has deerworm. And then the veterinarian would go out there and do a neurological exam of the animal and do sort of a scorecard on it. And the farmer would start the animal on treatment right away, regardless of whether the veterinarian could get there right away. And we sort of told some of the farmers to start with treatment A and some of them to start with treatment B, and to rotate. The first animal they had come down with it would get treatment A, and the next animal would get treatment B. And then we would videotape the animals that first day, and then the vet would come back around 5 days later, or after the animal had been treated for 5 days, and videotape the animal again and video score the animal again. Next slide. And our goal in our study was to look to see whether ivermectin was really needed in the treatment. And I realize right now I'm talking about chemical treatments. And in a little while, I'll talk about what a farm that's certified organic, what you're up against, and what are some of the things that you can do. And so we wanted to see whether you needed ivermectin, because theoretically ivermectin can't pass through the blood-brain barrier. So it shouldn't aid in treatment unless the animal's in the first 10 days of being infected. And usually in the first 10 days of being infected, the animal's not going to show any symptoms. And so we used a steroid, we used dexamethasone, and the purpose of that was to try and control the nerve damage. It's an anti-inflammatory, and we wanted to minimize that nerve damage. And some veterinarians like to use it at a fairly high dose for 5 days. In our case, we used it at a heavy dose for 3 days and then dropped the dose to half that. Just because it is a steroid, it makes the animal more susceptible to pneumonia and other issues. And so if your animal's down and you're not really good about keeping it on the chest floor, it's getting on its side, you may run more risk of pneumonia if you've got it on the high level of dexamethasone all 5 days. But as I said, some veterinarians prefer to keep it at the high level for 5 days. And if you use Banamine instead, which is the active ingredient would be your Vonixin, there's a 60-day withdrawal on that for sheep. On Dex, I don't believe there is a withdrawal. And then we use fenbendazole, which is supposed to be able to go through the blood-brain membrane, and that's sold as Safeguard, and we were using the oral goat Safeguard, which on it. And then for goats, that only had a 10-day withdrawal, even at the super heavy dosages we were using it at, but at sheep, it had a 54-day. And then we were using either ivermectin or an ivermectin placebo that had the medium that normal ivermectin is in. We were injecting that medium into the animal. The vet company was nice enough to provide us with that medium. And so we were using it as sub-Q for 5 days. And we were sort of shocked. We got, when we went to FARED, the food animal residual avoidance database, they gave us a withdrawal period of 96 days for both goats and sheep. And that's primarily because of not knowing when it would clear out of the liver. Okay, so they would be condemning livers. And so you can see that if you're using this for 96 days, it's gonna, and the animal doesn't recover, and you're hoping to eat the animal yourself or something, you've just made it, if you use ivermectin, you've made it so that it's going to be a long time before you can eat that animal. Next.
I just have a question, Todd. In the dexamethasone, if you have pregnant animals, is it okay to use?
Okay, and I thank you so much for pointing that out. The reason we list Banamine here is there's 2 reasons, but the main reason why it's listed is if your animal is in her in her last month of gestation, giving them dexamethasone can cause them to go into early labor, which you definitely wouldn't be wanting. So you would not be using a steroid like dexamethasone on them. Okay, and instead you would, in those cases, we use Banamine as our anti-inflammatory. Another thing is flunexin is permitted. It's not, your dexamethasone is completely prohibited for organic animals. Your Banamine is permitted for pain relief, and also as part of that as an anti-inflammatory. But it's only permitted in the case, I believe it's only permitted for breeding stock animals prior to the last third of gestation, or when and prior to their nursing a lamb or kid that's going to be sold for organic meat. And it is allowed in dairy animals. You need to be following the label. And I would definitely say check with VOF, or both about that prior to using Banamine. And when it comes to your fenbendazole,
sorry.
Yeah, I guess if we go ahead and talk about some of the organic stuff now. So if you end up with a young animal that's scheduled to go for slaughter that's showing up with some deerworm signs, you have to really think about what you want to do. Sometimes these animals will spontaneously recover, and sometimes when they're in the slight toe dragging stage or slightly weak in the back stage, sometimes that stage will take a couple of weeks to go through before they actually go down. And so I know in our study, we had some people that, because of that 54-day withdrawal on the safeguard for sheep, said, no way am I treating these young animals with that. And their customs exempt slaughterhouses were willing to accept those animals when they were just slightly dragging on a hind leg. But it really depends on the slaughterhouse. If it's a USDA slaughterhouse, that may appear to be a neurological sign, and you especially couldn't send one in with twirly eyes or anything like that. It's going to get condemned. They're not going to accept it. And if it's down, it's going to be condemned. So it really depends on what market channel you have available for getting rid of that animal, and how used that market channel is to deerworm, to dealing with deerworm issues. And so sometimes the best choice is to just immediately, when you realize this animal may have deerworm, it seems a slightly off on those back legs, to get it slaughtered as quickly as possible. Other times, if the animal that's infected are your breeding does or your breeding ewes for a meat operation, or if you've got a fiber operation, or if these are dairy animals, then you do need to, usually go ahead and do your fenbendazole treatment. And fenbendazole is allowed in emergency situations. Ivermectin is no longer allowed in emergency situations, so you would be deciding whether you want to use some Cydectin in there instead. But when I get into the results of the study, you'll see why often just limiting yourself to that safeguard is probably fine. And so if those breeding stock animals aren't in the last third of gestation and aren't nursing lambs and kids right then you can go ahead and treat them with fenbendazole without, and they can remain on the farm. And the same thing with your breeding rams and your breeding bucks. That animal will never be, that cull ewe or that cull ram will never be able to be sold as organic meat, but they can remain on the farm and they can produce organic offspring. And if it's a dairy animal lactating, then you would have to, I believe it's a 90-day withdrawal that you would have to follow for milk withdrawal. And the thing is, I know on a lot of farms, we get infected with deerworm right as we're starting to breed our animals. So it would be, it's not, depending on what time of year you're breeding for or whether you're practicing out of season breeding, we're often getting heavily, our biggest incidence of infection with deerworm is in the fall. And so often you wouldn't have your animals in the third trimester at that point. And when it comes to dexamethasone, no, you absolutely can't use dexamethasone. So you would be talking to your veterinarian and to your certification agency about allowable anti-inflammatories. So like, while your omega-3 fatty oils, like your fish oil and your flaxseed oil are high in those, I'm not sure that they last going through the rumen, and you would want it to last going through the rumen. So that's where you might be more looking at your turmeric and your ginger. And then also just talking with veterinarians, if you're working with an herbal consultant, talking about what anti-inflammatories they recommend for nerve damage, and finding out if those are herbal ones that are allowed for organic usage or not on livestock. Okay. And then prevention is going to be a real big part of what you're going to want to be practicing with a lot of this. Okay, so basically this was our study. So Betsy, go ahead to the next slide. So no, there is, so the question's being asked, is there a tree? So this is a young ewe here, a yearling with it. Betsy, can you hit the, yeah, hit that again. And you can see she's got the typical hind legs, drag. It's pretty advanced in her. This isn't an animal that you're going to get away with taking to the custom exempt slaughterhouse, probably. Okay. She's definitely showing her neurologic signs at this point. If she hasn't been, and this is that same ewe 5 days later, and you can see that she's shown a lot of improvement with chemical treatment, though sometimes we'll have animals spontaneously recover as well. So when it comes to, if you've got an animal that's infected that you do want to market, you can certainly go ahead and try. Your copper oxide wire particles will not be of help because the deerworm doesn't go to the true stomach. Okay, that's not where it hides out. It's hiding out in the spinal cord. So, and in order for copper oxide wire particles to kill barber pole worms, and they kill it in the true stomach, or that's so copper isn't going to work. I would not recommend black walnut hulls, because black walnut hulls do cause like laminitis problems in horses, and if they have a mycotoxin or mold on them, they can also cause neurological symptoms in dogs. And so you're not wanting to use a chemical that's going to cause a lot of neurological damage, whether it's herbal or not. So, but I don't know if like Vernitox or something like that, you could always go ahead and try that. You know, there's nothing wrong with trying, but basically that's the kind of animal you would put in your own freezer. If you're getting to it too late to feel like your custom exempt slaughterhouse will take it for you. You can certainly slaughter at home for your own use. There's nothing, deerworm is not going to spread to a human, so it's very safe to, to go ahead and slaughter for that. And so that would be some of my advice. And then, as I said, as far as your breeding stock that is producing those organic lambs and kids, if they're not in the last third of gestation, you can use it on them without jeopardizing their future ability to raise organic lambs and kids. But again, talk to your certifying organization and your inspector when you have an animal go down with deerworm to figure out what's going to be allowable. And this was an infected deer or goat at my farm, and you can see that she's improved in 5 days. She hasn't improved completely, and she never improved completely, but she was pregnant at this time. She was in early gestation. She had just gotten bred, and she did produce, I think, 3 more litters, and then we culled her after the 3rd litter. For each litter, she would go down for a day or 2 before kidding, and then by the last one, she was going down, about a week earlier, and we went, it's time. That nerve damage is building up. It's time for us to cull her. We're now going to go into part 2. And are there any questions on this first part for Betsy or for me first? And one thing actually, Betsy, if we could share a screen for a minute, I can show the NOFA New York list of organic or of allowable things for parasites. Okay. So Betsy, should I hit share screen now?
Yeah, if you have it up.
Okay. And
If you have it up so you can share it.
Okay, can people see this?
I can see it. I can see.
Okay.
I can see it.
Can't see
All
the whole
right.
thing, but I can see some of it.
We will send this out. If Kelsey's okay with this, we will send this out to people. So I would tend to avoid, for trying anything for deerworm, I would tend to avoid black walnut hulls in that situation. And again, as I said, copper oxide wire particles are not going to work in that situation. But you can be looking at some of these other possibilities. Like I thought your Vera, like you could try your Vermitox, or possibly your Nematox, you know, just because, but if you don't see much improvement, then I think the main thing would be to go with your chemical ones, and unfortunately. So I think prevention is a huge part of it, and a lot of prevention. If you have guardian dogs on your farm, having a way where your guardian dogs can patrol a lot of your pastures, as well as the pasture they're currently in with the animals. And then over the winter, really figuring out where your deer are bedding. And if your family dog and you can go out to those areas and really discourage them from bedding in any areas that are areas that you're pasturing in, that can be helpful. We definitely had people who noticed if they we had farmers who went from being part-time on the farm to being full-time on the farm, and said that, hey, when we became full-time, we were active enough here that the deer just really cleared out of the pastures. We do have Steve Gabriel did a study, I think their Wellspring farm did a study, and I can send you all the link for it, where they were looking at using their ducks in their grazing paddocks that their sheep were in. And Betsy, I'll stop sharing this screen and see if I can bring up their screen for a minute. So how do I get, okay, stop share.
There you go.
And then share screen. And oh, I don't see it.
Which one are you wanting to share? I might have it up.
Oh, Steve, so they have a PDF of their report of what their duck studies with their mushrooms, and then also with their deerworm.
Okay, I don't have that. I can find it
Okay.
if you give me a minute.
I'm sure.
Because I had it up earlier.
Oh wait, here it is. I have it. So let me go back and see if I can share screen and get this one up. Yeah, here. Okay. And so the main thing that they were finding, they had a lot of trouble monitoring the slug and snail population in their paddocks. So that made the study really challenging for them. And then it did appear that while the ducks would bring the slug population down, whenever the ducks got put into a paddock, that the population would recover really quickly. These arrows are when the ducks went into specific paddocks. And then you can see how like with this blue line, how the slugs quickly recovered. And with this yellow, I think it really only stayed down for 4 days. But they felt like the problem was more that they were like, that it was a lot of trouble moving the ducks through there. And there was a whole bunch of trouble and time spent trying to monitor how many slugs were out there. So they weren't saying that, oh, forget about using ducks or forget about using guinea hens. But they were just saying that for the bang you got for your buck, unless you were already going to be pasturing your ducks, it probably wasn't worth it to buy ducks and bring ducks in specifically for that purpose. And so unfortunately that was their results, was that the slugs did come down. I know that at our farm, the main thing that has helped is just making it where the deer are not comfortable being in those pastures. We used to do great with our farm dogs patrolling. and us taking walks out there in the wintertime of just keeping the deer off our land and on our neighbors' land. And then it became a problem when our neighbors started raising beef cattle on the land. Then the deer pressure was such that the deer started coming back over to our place. Okay, so I'm going to stop share. But any prevention type stuff you can do using your dogs. And the best thing is to try and get that prevention going if possible. Just get it so your white-tailed deer are not happy there. And also knowing that the first time you come into a new brush area, that's when your problem's going to be the worst. You know, when you're coming into a new area bordering the woods or partially in the woods, or into a pass, or when you're renovating an area with your goats, that can be that's going to be the worst year usually, that first year. Okay.
I tried it with geese, but the geese were hard to keep where I wanted them to be eating the slugs. But the idea was great, but the practicality of it was really difficult.
Yeah, and as I said, we will make the link to Stephen. I think is it Elizabeth Gabriel's study that they did with Sarah on that. Okay, so knowing your weapons. And so
Tatiana, sorry, do you mind if I just hop in? There's a bunch of questions about whether
Sure.
VOF has a similar list that's great, like that NOFA New York list. And I posted a link to VOF's page. It looks like they don't keep a list on the website because it's a live document and they update it frequently. And so they're saying on that website, the best thing to do if you want a list of those approved materials, that you should reach out to the VOF office for their most up-to-date list, and they'll send it out to you. And I will, I'll share these resources that you're touching on after the webinar by email.
And actually, when I talked to Bay and to Kyla today, they were saying that they actually use their agreement with NOFA New York is they actually use the NOFA New York list.
Oh, great.
So you have that NOFA New York list and can send it on. And then what both NOFA New York and what both said was to please, when you go to treat a deerworm animal or another animal, let your inspector know right away, because things could have changed from day to day, you know. And I noticed on the VOF website and on the NOFA New York website, if you go to the original fact sheets under resources for, you know, starting a dairy or starting a sheep or goat dairy or a sheep or goat meat operation, it still lists ivermectin as being allowable, and it doesn't list cydectin at all. So by allowable, I mean, meaning in an emergency situation that you can use it on a breeder animal or a dairy animal, but you still could not use it on a meat animal and have that meat animal harvested as organic. So because it does change all the time, it's really important to check with your inspector on what's allowable.
Great, thank you.
Okay. So any more questions along that line? And we will make those sheets available. And so proper use of traditional weapons. Today, we're going to go over chemical dewormers a little bit. And I think Christine is saying that if you are a VOF certified organic farm, that you can go to the portal and find the list, their list there as well. And so we're going to spend a lot of time next week on pasture management, on nutrition, genetic selection, and the immune system, and on selective deworming. And then we'll also go into part 3, which is sort of the newer things that have been developed, or things that are in the pipeline that may be beneficial. Okay, so today, again, we'll just focus on the proper use of your traditional weapons. Okay. And so chemical dewormers, a valuable limited resource that must be managed properly, and they may not be available to you, particularly if you're certified organic. Okay, next, there's 3 drug families. Go ahead and hit enter. Okay, you have your benzamidazoles, which are your white, they're usually known as your white paste dewormers. And most of these are very pretty safe to use because they have been around a long time. The original one was dibendazole. There is a lot of resistance showing up to them. And then we have our nicotinics, which would be things like your levamisole and your Morantel. And we'll talk more about those. And these are, in the old days, people used to use chewing tobacco as a dewormer. It can be pretty toxic at times, and it's hard to know what dose is right, but that's been used. And then the third family available to us in the United States, the third chemical family available is your macrolides, which include your ivermectin and your cydectin and various other drugs. And so we'll talk about those in individual detail next. All right. So your white trenches, go ahead. Yeah, they hit most of your strongyle worms, most of those gastrointestinal worms that reside either in the abomasum or in the intestines. They have a wide margin of safety. They're fairly effective against tapeworm. Now, not all of these will actually kill the tapeworm head. But as we said, tapeworm, usually with tapeworm, you're just trying to knock it back a little bit. And it's like coccidia in that animals will normally develop a resistance to it. You're only going to see it as a problem really that first year of life. And in animals that are usually really compromised nutritionally. And people will say, oh, my goat died from tapeworms, but often what happened, and it can, we did mention that overeating disease issue that can happen. But for the most part, what's happening is the same time the animal gets heavily infected with tapeworms, it gets infected with your strongyle worms at the same time. So it really could have been the barber pole worm or brown stomach worm or something else that was the actual kill. But what you saw were the tapeworms. Okay. The valvazin, the neat thing about it is the only one of these that's fairly effective against adult liver fluke, less so on your immature fluke. But the big problem with it is it should not be administered to pregnant animals. Okay, next. Oh, and I guess I should, if you go back there a second, I'm sorry. I guess that's about it. Your oxyfendazole, which is your Cyanotic, isn't licensed for sheep and goats, I don't think. And if you're
I
already
don't think so either.
licensed to the other, it won't be that helpful usually. Okay, next slide. Okay, so your nicotinics, a lot of these are sold as oral dewormers. Your gold pellet and stuff. And several of these are only effective against adult worms because we'll go into a life cycle later on with your strongyle worms. And some of these worms are immature stages are capable of hibernating in the animal, hibernating in your sheep or goat. And when they do that, when they hibernate, they're much harder to kill because their metabolism slows down. So of your nicotinics, it's really only your levamisole that's effective against these hibernating larvae. The levamisole of all these commercially available dewormers probably has the narrowest margin of safety, especially the injectable product. So you do want to be pretty careful of the weight of your animals and following that label pretty cleanly. And it's marketed as prohibit nowadays, as well as levamisole. Next slide. And okay. And then you have your macrolides. And this was the last class that was made available in the United States. And that was years and years ago that it was made available. Again, broad spectrum, wide margin of safety. It's effective against sucking lice as well. So that's a plus on it. Of these, cydectin was the newest drug of that group. And again, that was years and years ago. And it was touted, it was really good at killing eggs. And so it was going to be the miracle dewormer. And unfortunately, animals built up resistance to this class of dewormers pretty quickly, in part because of just the genetic, the genes that are involved for this. And if people want, at some point, we can talk about that more. It's a codominance thing. And so what happens if the mother worm has inherited the gene for resistance and the father worm hasn't, and they crossbreed, there's a good chance of their offspring inheriting, you know, the dominant gene from one parent and the non-dominant gene from the other parent. And because this is a codominant situation, even if the baby hasn't gotten both of the baby worm hasn't gotten both of the dominant genes, it still has some resistance to the dewormer. And unfortunately, ivermectin was set up to be used as a poron initially, or as an injectable, which meant that it was staying in the body in a low dose for a long time. And so as the animal would get infected with worms every day, you know, as they're out on pasture, the genetic pool of worms was selected for this codominance as well as for this dominance. If the animal carried even one gene for dominance, that worm was better able to survive than those worms that carried neither of the, those worms that had inherited neither of the dominant genes from either of their parents. And so it built up in the population very quickly, this ability to carry it, you know, these dominant genes. And so that's why ivermectin worked for so little time, as opposed to your levamisole, which its most common way that barber pole worm stays resistant to it is through a double recessive. So you have to build up a whole bunch of the recessives in the population. Okay, so I'll stop talking about that.
Well, I wanted to mention that, you know, when you go to, like, you go to the feed store to buy a dewormer, about the only thing you can often get is ivermectin, and it may not be effective at all in your flock or herd. So you need to look for a source of some different dewormers, like in mail order or the veterinarian or something, so that you can have some choices.
Right. Okay, next slide. Okay, you're right. So often you may be ordering these through the mail, through Jeffers or Valley Vet, or there's a whole bunch of different companies, or through your veterinarian. We're almost always using these with extra label drug use, which means that we're using them differently than the FDA label on that dewormer bottle or that dewormer envelope says how to use it. Only fenbendazole, when it's marketed as Safeguard, Morantel, and albendazole are FDA approved for goats, and albendazole is actually only approved for goats for liver fluke. Okay, and when it comes to sheep, it's not really much better. Only albendazole, your ivermec drench, your Cydectin drench, and your levamisole are FDA approved for sheep. Safeguard is approved for mountain sheep, but it's actually not approved for regular sheep, but it's veterinarians often do use it, but you have to remember that the livers are very likely to be condemned and that the withdrawal period is actually really long if you've used Safeguard, because they don't know how long because it seems to linger in the liver of sheep.
At least you can use the valdazen, which is the same family.
Right. And you sort of go, well, why isn't the valdazen lingering in the livers? And is, you know, it'd be nice if they did a few more studies and really verified a lot of this. And the use of a product that it's different from its label, as I said earlier, is what we call extra label drug use. And it requires a veterinary prescription. And as part of that veterinary prescription, you have to have a valid veterinarian and patient client relationship. And so that's where getting to know a veterinarian and having them come out to your farm once a year for at least a well animal check, where they just go through and see your farm. I know in New York, we have the New York State Health Assurance, Sheep and Goat Health Assurance Program. And so the state will actually pay for the state vet and your vet to come out and meet with you at your farm for about an hour. I think the first visit, they're allowed to meet with you for 2 hours. And then after that, they're really only paying for an hour of your vet's time. But most of that actually ends up being in your house, asking you what your goals are. Are you trying to eradicate yonis? Are parasites your big issue? And coming up with a plan of attack for how you're going to deal with issues. But they do go through your herd as part of that, but this would not help you out in emergencies, but at least it helps, it makes you have one visit from your vet that's almost a well animal visit where they're just coming and seeing how things are. And then when you use these things off-labeled, your veterinarian will normally check with FARAD, the Food Animal Residual Avoidance database, to see what the recommended withdrawals are. And unfortunately, depending on who answers their query with FARAD, they can get different responses, which can be really frustrating. And there used to be a frequently asked questions section of FARAD that did go through some of the withdrawals and stuff, but I noticed that they've changed that section now, and the frequently asked questions are different, and they're no longer stating those questions that answered sort of what a veterinarian had said already, what FARAD had said already as far as how long before you could use the milk from an animal that got safeguard and stuff. So it's a bit frustrating that you can't always get the same response depending on who you talk to there. Next slide. So as we said, there's few that are now available for sheep and goats, and many of those because they've been used year after year and sometimes just pretty much overused or used in such a way that, unfortunately, we develop more resistance in our animals to them. They often don't work as well as the label would indicate they're going to work. And so for goats, we usually say you should be using 1.5 to 2 times the sheep or cattle dose per live weight pound of that animal. And this is because goats have a faster rate of passage of things they digest through their system, and they have larger livers that break down chemicals quicker than those of sheep or cattle for their size. And poron works poorly in goats and sheep, and so we usually aren't recommending the use of a dewormer as a poron. We usually say that because of the same thing, that they shouldn't be injected, that instead giving them orally is the best thing to do. And you want to give them behind the tongue so that the dewormer goes to the rumen. If it goes towards the front of the tongue, the animal has the opportunity to go, this tastes awful, and have a gag response. And the gag response, just like in a baby animal, just how in a baby animal liquids are shunted to the true stomach, a gag effect will cause that dewormer to be shunted to the true stomach.
Sorry.
Okay. Yeah, if you can go back. And instead, and if it goes to the true stomach, it breaks down really quickly in the acidity of the true stomach. So you're usually wanting it to go to the rumen first, so it lingers in the animal longer. And then, of course, observe the withdrawal period. You will be you'll be getting links to the American Consortiums for Small Ruminant Parasite Control website, and they just updated in, I think, October, they updated their dewormer list for goats and for sheep and for camelids. And they talk to FARAD when they update that list. They talk to FARAD and get recommendations from FARAD of the withdrawals at that time for the kind of dosages they're recommending, which are off-label dosages. So we'll make sure that you get a link to that. And then And then dewormers in your feed or water, the big problem with those, and it's the same with your coccidiostats in the water, is it's hard to make sure that each animal got the right dosage. So that's why we often like to give them orally directly into the mouth of the animal. Next slide. Okay. If you're starting to see resistance, then especially with your white paste dewormers, it seems efficient, seems to help the efficiency of that dewormer if you can hold the animal off of feed 16 hours before you give the dewormer, and then for 12 hours afterwards. And so obviously you wouldn't do this kind of fasting in late pregnancy because you might cause the animal to go into ketosis. Okay. And then also deworming twice. So using that full dosage twice, 12 hours apart, seems to help those the white drench family to stay more effective. And then deworming on the same day with 2 dewormers from 2 separate families can be helpful. But you would only use that when you're selectively deworming. If you did that with your whole herd, you would just be building up dewormer resistance even faster. Next slide. Okay. And then someone was asking, I think Christine, you were asking about if you're bringing in animals out of state. And actually, Christine, I would say if you're not an organic farm and you're bringing in animals from a different farm, often doing what we often recommend is to give all 3 dewormer families to that animal and then compost that manure. Don't spread that manure out in your pastures, because the only worms that are going to survive those 3 families are superworms that have built up resistance to all 3, where the gene pool has built up resistance to all 3 dewormers. And so you wouldn't want that individual worm to be putting out a whole bunch of eggs on there. And then they're saying, hey, they were given dewormer prior to coming to our farm. It all depends on how effective the dewormer was. So you would often, before you put them out on your pastures, it would be a good idea to do a fecal sample and to see how many worm eggs there are in that fecal sample, or if it's pretty clean. If you bring the animals in at the beginning of winter and they're with your herd all winter before they go out to pasture, they're going to usually have less, their worms will have intermingled with your worms, and there's less chance of their worms having a big effect on your pasture. If you're buying them and you're putting them out in your pastures, you're buying them this time of year and putting them out in your pastures, they can have a pretty big effect on changing that worm population in your herd. So that's where it is good to do a fecal sample and check. And often that combination is going to get more worms than using one family alone.
Thanks, Tatiana. I just want to do a time check. I've had a couple people say they have to hop off and do chores.
And I'm
yeah.
all done. We're not going to go through any more of this. So,
Okay.
So I can continue answering some questions. So Elsa's asking, when you do a fecal sample, do you combine samples from a lot of animals into one sample? No, you only do that if you're sending it off to get a drench right test done on it, which is where a lab is going to look at all of those, and they're going to put them in little, not petri dishes, but little pools where they directly put the dewormer in there with the hatching larva and see which dewormers have an effect on those hatching larvae and which don't. Instead, you want to sample multiple goats separately. And we usually say, if you're wanting a good idea of your herd, pick a couple of goats or sheep that look pretty poor in your herd and a couple that look pretty good, and look at their fecal samples, and that will hopefully give you an idea of the range of what's happening in your herd. Because when you pull those samples, that animal that had 6,000 worms, getting it combined with an animal that has 0 or 5 doesn't give you a clear idea of what the problem is. You may have it coming out that, oh, on average, we have 900 worm eggs. That doesn't seem too bad, when really there were a couple of really critically ill, critically infected animals there. So it's usually best to pull them individually. Any more questions?
I see somebody asked if nicotinics kill bees in the feces. I don't, hopefully the bees wouldn't be in the feces.
Yeah, I do not believe that it causes any issues. We've had trouble with ivermectin and dung beetles. And it's also, it seems to be in particular cases. And there are more studies going on right now. I know through Cornell Cooperative Extension with dung beetles, and what affects them and stuff. But I know that we do use ivermectin, or excuse me, the dewormer you had mentioned was which one?
Nicotinics, so probably prohibit.
Right, so the levamisole family. And we do use that one sometimes with the solar array sheep at Cornell. And we do pollinator testing out on the solar arrays. And I know the sheep, the bee populations have stayed pretty healthy out there. So I think it's pretty localized in that feces. So I don't think it would be an issue for bees.
They also asked what is best for lambs, which the answer is it depends.
It really depends. When we do part 2, we'll be doing a little bit about dewormer resistance, and from farm to farm, based on your history of your farm and your flock, it can really vary what your farm is resistant to. So you're looking for something that is
It's got to work on your farm.
that works for you. Okay, basically. And one simple way to do that is if you do learn how to do fecal sampling and have a microscope you can borrow, or invest in a microscope, or have a county extension office that has microscopes available. If you have got a discussion group or something, then doing before and after deworming sampling. You right before you deworm, you take a fecal sample, and then 10 to 14 days later, you take another fecal sample and see how effective that dewormer was. That can work well for you. And that also works for if you're testing out herbal dewormers and stuff. That can be a quick way to see, hey, is this working as an acute dewormer in my herd?
Yeah, we found doing our feeding study that we thought we were using an effective dewormer, but then when we sampled them again 2 weeks later to see if it worked, there wasn't any change at all. So you can't assume that everything's working. There's another question here, Todd, about are there any breeds that are prone to be more or proven maybe to be more
we'll be
disease
talking
resistant?
about that during part 2. As far as some of the breed, and I'll probably ask you guys to talk a little bit about, your breeds and stuff. It also depends. You can abuse a breed and make that breed less resistant to parasites, yourself. But yeah, it's genetically as inheritable as milk yield. So you can, there's definitely a strong genetic component to it.
I just realized I can stop sharing while we do this.
Yeah.
There we go.
Right. And you guys have been really, really patient. Any more questions for Betsy or myself? I know we went through those egg charts pretty fast. We cannot make those egg charts available online very well. You do have them in your PowerPoint, in the PowerPoint slides. You have them available to you there. For people who come to the in-person, we will have those egg charts available there. Okay, but we're not allowed to put them online.
So there's a question about, can you breed for parasite resistance? And I think we cover that next week.
Yeah. And
you can select for resistance, yes.
Yeah. Okay.
All right. Thank you, Betsy, and thank you, Tatiana. And I will follow up with all these links that we've mentioned. I will email everyone who's registered and attending. I'll send out an email with handouts and some more links and information, as well as a link to the recording. Some people had to leave early or join late, and there will be a recording of part 2 as well. So the next webinar will be part 2 next Monday at the same time, 7 to 8:30. Yeah, anything else, Betsy and Tatiana?
That's
No,
good.
I'm looking forward to coming to Whiting, Vermont.
Well, we did split this up this week because because it's a lot to absorb all at once. So we're hoping by doing it this way and then covering the other part next week, it'll give you a chance to think about it a little bit and remember it a little easier.
And I got a little wordy because I was aware that Betsy was going through her time in less time than she thought it was going to take. That's why I said, "Oh, can I talk about a case study about coccidia?" Because I was going, "Wait, she's getting to me way too soon." And then I blabbed my mouth off about deerworm. And anyone who knows me knows that I tend to talk way too much. So I'm sorry.
I think the case studies are great. I think
Very
they really
interactive,
illustrate.
so I feel
Yeah.
bad about the fact that we're not able to interact with you guys as much as if we were all in person, but this was good. Okay, so
This is great. Yep. And hopefully a lot of people are signed up for the in-person on-farm session. So we'll have some interaction then.
And you said there's a little more room in the morning session if people
There
might
is still
want
room in the morning session. If anyone here still wants to join for the morning session, 9 to 12 on May 23rd. The afternoon session is full, but we have about 11 spots left in the morning session.
all right.
All right.
Okay.
Everybody have a great night and enjoy the nice weather.
Okay.
Thanks. You too.
See you all. All right. Bye-bye.